Basically, the general rule of thumb for most cases, for people who are especially who are healthy, really there's no need to take supplements for doing a water fast. It is called a water fast for a reason. It's a water only fast. You're just drinking water. Now there's the exceptions. Hi, I'm Dr. Grand and welcome to my channel. I am a family doctor in the state of Washington where I primarily focus on both conventional and holistic medicine when it comes to my clinic helping out my patients with helping with their conditions. And without further ado, welcome to another video. All right, reason number 3 of why you should or shouldn't take supplements is this your first time doing a fast? And why I ask that is a very good, important question to ask yourself, because really for people who have never done a fast, it takes time for your body to adapt, and it can be really hard on the body unless really, and I've talked about this in my other videos before, if you have been somebody that's done like cleanses in the past, or if you've been living more of a whole foods kind of diet, people tend to do better on a fast, especially if it's their first fast, because they've actually already kind of increased that detoxification process in their body, but not only have kind of really, they're in a more healthier state, so they'll actually tend to do better on a fast. So it really depends on your state. If you've been eating really junky your whole life and then want to do a fast in the first time, you might want to do supplementations. And here's why. Because really it's looking at the symptoms that you will be experiencing. Very common symptoms that people can have is heart palpitations. That's one common that people can have. In fact, you know, I had a recent patient that dealt with heart palpitations while they were doing a fast, and they didn't know why, because they've done lots of cleanses and fasted before, but they're experiencing it. And so what I usually recommend for people is magnesium, maybe during the fast, because magnesium is actually really good for the heart. So because you could be really depleted of the magnesium while fast, especially if you have a tendency to have heart palpitation issues or heart conditions, magnesium would be a good type of supplement to be taking. Now, some other symptoms that you can actually experience is headaches, lightheadedness, especially if it's your first time going on a fast. And that's where I like to recommend to my patients that if it's their first time, to actually do some supplementation of some electrolytes, because that can really help with the symptoms of the headaches and the severe lightheadedness and dizziness. And really, if you don't want to do supplements, sometimes if you have a hard time and need to break the fast early on, doing some kind of electrolyte drink or even bone broth can be beneficial when you're trying to slowly come off of a fast if you're finding it's too difficult. Now, if you're somebody that actually is taking medications, you still need to actually take medications while you're on the fast. For most cases, you know, there's definitely no question about that, unless you've gone and seen your doctor and they've okayed it because they've actually been monitoring you and checking you. But for most cases, really, you actually have to be taking medications. Really no exception. So if you are someone that actually does have severe conditions and are taking medications, you do want to check with your doctor first before even considering doing a fast. Not only whether you should or should not take supplements, but actually if you should or should not do a fast. Really check with your doctor. Basically, the general rule of thumb for most cases, for people who are especially who are healthy, really there's no need to take supplements for doing a water fast. It is called a water fast for a reason. It's a water only fast. You're just drinking water. Now there's the exceptions, and I already talked about those exceptions. So if you are one of those exceptions where you are electrolyte insufficient, or you have a degenerative condition, or really have other heart or health concerns, then supplementation might be something that you need to do. But if you're looking for the ultimate benefits from getting a fast, really supplements are no need to use, because this ultimately will increase the autophagy, be able to regenerate new cells, be able to help increase the cleansing process and give the body a break from anything coming through the body other than just water, to be able to focus on cleaning things out, getting waste out. That's why I really highly promote usually doing no supplements unless there is a need. Okay, so that is my third and final reason of why you should and shouldn't take supplements during a fast. It finishes our video series. Thank you for watching these video series with me. If you liked this video, give us a big thumbs up, and then of course share with your family and friends. Comment below if you have any questions. I'll make sure to answer any of those questions that you have. And if it's your first time on our channel, go ahead and subscribe right here. And if you missed the other reasons of why you should and shouldn't take supplements during a fast, this is the first reason, and then of course second reason. And then, of course, I will make sure to provide more great health tips and other fasting detoxification videos for you guys. So until next time, this is Dr. LeGrand out. Thanks.